Thank you very much for returning to our Auralsplint video presentations. Our second video intends to explain how the Auralsplint uses the abilities of the animal to heal itself. Research shows veterinary interventions consists of either aspiration and injection or some form of open wound drain to keep the ear from blowing up and spoiling their mattress sutures. We find these surgical treatments archaic and without good reason to allow the blood to leave the hematoma site. We feel it is the blood that is used by the animal to heal the wounds and must remain in the ear in its whole blood form. At this point, we need to inform you we are not licensed veterinary doctors and do not intend this information to replace that of a DVM, but through extensive research and reporting, we are certain our treatment outperforms any other treatment on the market today and are able to provide this veterinary RX treatment kit to the public without fear of reprisal through a signed Samaritan waiver no different than that of the veterinary clinic. A splint is a historical medical assisted healing device used to hold body tissues from movement and to protect them from further injury while healing is allowed to set in. Typically, a splint is used for only a short amount of time, otherwise a cast would be used. We have found through our continued Auralsplint research, 2 weeks is the length of time for our treatment to allow permanent healing to occur in most cases. During the first week, after a near complete hypodermic needle aspiration and correctly and tautly applying the Auralsplint plates, the hematoma area, once filled with fluids, is now located and contained against the Auralsplint plate on the underside of ear and against the non-elastic taping on the other. This sandwich prohibits the expansion against and away from itself and leaves only a thin amount of area to refill. Once the damaged blood vessels fill and compress the available volume and equalize, the fluids become still and rapid coagulation occurs, forming the thin layer into a blood clot blanket surrounding the broken blood vessels and allowing the animal to seal and heal them through the regrowth of tissues. The second week, after the fluids in the hematoma region have become still, clotted, and sealed the broken blood vessels, the clot grows fibrous attachment tissues against both the cartilage and the skin. Think Velcro, how it grabs the other side and holds on. During this granulation growth of tissues, the red blood cells are no longer needed and are stripped away to be reabsorbed and dispensed of, leaving only the newly formed fibrous attachment tissues permanently binding the skin back to the cartilage. A cosmetic bonus feature occurs since the Auralsplint only allows for a thin layer of clot to form. The normal reduction or shrivel is limited or reduced for only a small amount as compared to a bulbous, non-treated aural hematoma clot. Cosmetics are important, and the ear overall health is returned into its natural form of either pendant or erect. As I have stated, rapid coagulation occurs once fluids become still, and if your hematoma has stopped growing, then you have merely a few days for a hypodermic needle aspiration to be effective. Time is of the essence, and you should have a hypodermic needle aspiration performed before an estimated 7 to 8 days from onset. After this aspiration, you have 4 days until another is needed. Take this time to go to our website and order your treatment kit for less than $100, shipped next day in the USA. Compare to the wounds created and surgical costs around $1,000 or more. This is a deal you should act on today at Auralsplint.org. God bless and happy healing. Auralsplint.org.